Thank you for the opportunity to speak on behalf of AIDS Healthcare Foundation Europe, European Federation of Nurses Association, Worldwide Hospice Palliative Care Alliances, International Federation on Aging, and Thalassemia International Federation at the 72nd session of the World Health Organization Regional Committee for Europe on agenda item Regional Action Plans 2022 till 2030 for ending AIDS, the epidemic of viral hepatitis and sexually transmitted infections, and tuberculosis. We are pleased to see that the HIV epidemic in Europe continues to be on the agenda at the Regional Committee session. Final progress report, Action Plan for Health Sector Response on HIV in the WHO European region, which is submitted to the 72nd session, clearly presents major remaining challenges in the European region as new HIV infections continue to rise. The eastern part of the region lagged behind 1990 targets considerably, with respective rates of 70%, 75%, and 94%. The challenges to contain the HIV epidemic are driven by insufficient access to HIV prevention, testing, and treatment services for key populations, including blood donors. Ending AIDS is not possible without addressing the needs of these key populations and scaling up HIV services to them. We would like to reaffirm the point we made in our statement to the 65th session in 2015, which continues to be not only relevant, but gain even more importance. To address these challenges, a strong political commitment on the highest European level is needed. To turn the tide of HIV epidemic in Africa was possible by the united efforts of world political leaders and African heads of government. The PEPFAR and Global Fund resources, supported by strong national political will, made a change in HIV epidemic in Africa. We strongly believe that unless Europe's political leaders acknowledge the inequalities between the western and eastern part of Europe with regard to the number of infections evidenced by the prevalence of HIV in blood donations, and unanimously recognize the goal of ending HIV epidemic as part of their political agenda, we will continue to report of the continued increase of HIV incidence in Europe, and therefore more deaths from AIDS and tuberculosis, deaths which are preventable now in the 21st century. Hence, we support the 2022-2030 Regional Action Plan statement that renewed political and financial commitments will be required to go back on track in progress towards ending AIDS. Together with our partners in governmental institutions and the non-government sector, AHF Europe is providing HIV services to key populations and people living with HIV for more than a decade in both western and eastern parts of the European region. AHF Europe models of testing and treatment clearly show that a people-centered strategy and user-driven care are the key approaches to reach people in need and keep them in service delivery. Therefore, we welcome the Regional Action Plan's focus on placing the people at the heart of responses, which requires a pivot towards health system adaptations. Essential priority is to rise above disease silos through a partnership-based approach with primary health care, civil society, communities, and public health institutions. It is time to move declarations into actions that we can announce the end of AIDS in the European region in 2030. Thank you.